Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hello, Dr. Darrow.
Hello, Nita Valens. How are you today?
Great. And yourself?
Living it up.
Yay. Well, guess what? Everybody listening can be living it up, because if you're in pain, you've hit the right dial. This is Living Pain-Free with Dr. Marc Darrow, and we talk about musculoskeletal pain. What does that mean? Muscle pain, joint pain, tendon pain, ligament pain, disc, back pain, neck or knee pain, hip pain, arthritis pain. And basically we're talking about orthopedic pain, like if you have stiff joints, tendonitis, dull aches. Even if you don't know the problem, if you are in pain, then give us a call right here in the studio at 866-870-5752. And when you phone today, not only do you get to speak with Dr. Darrow, you get his latest book for free. Stem Cell and Platelet Therapy is the title, subtitled Regenerate, Don't Operate. And there's 264 scientific studies contained, and the foreword is written by Suzanne Summers, and there's even some research on hair growth and some solutions in there if that's your issue, just as an aside. And you can also find out much more about the treatment and Dr. Darrow by going to the website www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. So a lot going on here today. Saturdays at 10 is when we're here, and again at 1 p.m. And the number to call us again, write this down, 866-870-5752. That's our number right here in the studio. And here's the thing. If you're not in pain, but your husband or your wife is in pain, your kid, your parent, your friend, your neighbor, orthopedic pain is very common. So give us a call, and Dr. Darrow will hear you out and see what's going on. What do you think?
I love it. I love helping people heal. I've been doing this kind of work since my residency at UCLA a long time ago. And something I just lucked into because of my own injuries. And I was basically, the first couple of my injuries, I was healed overnight. And I've been working on my own body. I know people think that's kind of crazy, but I inject myself. And it's pretty easy to do when you know where you're supposed to go. What's that crackling noise? Is someone eating chips?
Oh, gosh, I wish. Who's got the potato chips? Get in my studio right now. Oh, my gosh, I don't hear a noise.
I'm going to go to a cool question here. It's
okay.
AVN of the hip. AVN means avascular necrosis. That means bone death. And it happens commonly in the hip when people eat steroids. Steroids meaning prednisone. A lot of times doctors give oral steroids to people when they're having back pain or neck pain, which is something I don't do. I don't like seeing people ending up with avascular necrosis of their hip, and that's what can happen. I've had it happen with two of my doctor friends already, which surprised me. I said, why did you take the steroids when you knew this could have happened? And they said, well, I was in so much pain. And there's better ways to get rid of pain than that. Regenerative medicine is the best way that I know of to get rid of musculoskeletal pain. And I've used it on both my knees, both my shoulders, my elbows, my right wrist, and other people have been doing my neck and back. When I said doing, that was a long time ago. They've been pretty good lately. But avascular necrosis is something that is, once it starts, I'm not saying you can fix it, but we can usually get rid of the pain in the joint. Okay, because once the necrosis starts to occur, the cartilage often can wear down around that area, and we can grow back the cartilage using regenerative medicine, platelets, stem cells, things from your body, and help regrow or proliferate new tissue to grow and secure that joint again. So if you're one of those people who the doctor says you've got avascular necrosis in a joint, that may be true, but that doesn't mean you need a joint replacement because of it. So this person says, I have AVN and have had one hip replacement and a shoulder replacement, and now they want to do the other hip. I prefer to do stem cells. What are your thoughts? Well, my thoughts are we work on avascular necrosis joints all the time. Not a big issue, and there's hope with it. We don't guarantee anybody success, so don't come in here thinking there's a magic wand that we're going to use on you. I'm always very, very honest with people. Some patients get mad at me and they go, why aren't you being my cheerleader? And I say, because I have to tell the truth. Nothing works on everybody. This works on a lot of people, but I'm not promising results. Stem cells are pretty amazing, and platelets are pretty amazing. So I would certainly, before I did surgery, I would do PRP, platelet-rich plasma, or stem cells, which we can get from your own bone marrow. So people seem to like that quite a bit. So yes, there's a lot that can be done. And, you mentioned something at the beginning of the show, Nita, about how you don't need to know what your diagnosis is to come into the office to see what we can find out.
Right.
But most of the people that come in have a phony diagnosis or a false diagnosis or a wrong diagnosis because most doctors don't examine the patient with their hands. I know that sounds crazy, but most of the people that come into my office who have had a failed surgery, when I ask, did the doctor touch you? They go, no. Why would they touch me? They did an MRI, they did an X-ray, and they told me I need surgery. Well, I don't think that's the best way to practice medicine, because you can find out what's going on, meaning find out where the pain is being generated from by touching the area and examining the person, moving the joint or the tendon or whatever it is, and touching it and finding out where the pain is being generated from. That makes the most sense to me. Looking at an MRI or an X-ray is not accurate in most cases. So I know a lot of you folks have had MRIs or X-rays and the doctor said, you've got this or that, herniated discs, hip arthritis, blah, blah, blah. But then when those people come to the office, I find that is not really the problem. So don't get a surgery until you know you need one. How do you find out? It's tough. You got to go to a doctor who does regenerative medicine to find out, because most docs do not even examine the body. They just slap up an image on the light board and say you've got this or that and go right to a surgery. And I'm against that. So I'd like to give out the phone number to the studio right now, and then I'll give out the phone number to my office. So grab your pen and pencil. I'd love to talk to you. The number to me right here, right now, live, is 866-870-5752. I'm going to repeat it, 866-870-5752. I'd love to hear from you and talk to you about your issues, or the issues, the pain that your parents have, your family, your friends, and we can talk about what's going on and help you heal, teach other people how to heal. You can help teach your doctors how to heal. When I was in training at UCLA, we didn't really think there was such a thing as healing. We thought there was medication and surgery. Now we know that we can actually regrow the tissue in your body and help you heal that way. If you want to call the office and find out more details about your situation, the number to my office, and there are people waiting by the phones, is 800-300-9300. I'd love to have you call to the office if you'd like to, 800-300-9300. And Nita, do you have anything you want to add before I take more questions here?
I do, because when you call today, you get Dr. Darrow's latest book, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And I have to say that after you published this book and you sent me my copies, I was thrilled because it's got a lot of research, and we know this is a new paradigm for a lot of people who think it's just drugs and surgery still. And regenerative medicine is the least invasive of any of those options. So
that's right. We always want to do conservative medicine, meaning surgery is the most invasive, and people don't always come out of it in a way that they expected. So it can lead to a lot of problems. I've seen a couple people die on the table from anesthesia. I think it was anesthesia. And it can get kind of scary. I know you folks don't want to do surgery, but you think there's no other answer, and you've seen an orthopedic surgeon or a neurosurgeon, something like that, who says the only thing they can do is operate. But it's time to wake up. There is a new paradigm in medicine. As Nita mentioned, I've been doing this work for 20 plus years and keeping people from going under the knife. And let's hope that you will be one of those if you're having pain and you don't need to think about doing surgery.
And let me give the phone number one more time, 866-870-5752. That's 866-870-5752. And think of all the people you've healed in the 20-plus years that you've been doing this work. Now, audience, I ask you, wouldn't you like to be one of those people? Give us a call, 866-870-5752.
You know, a lot of people who are new listeners don't know that the way I got to regenerative medicine was through a surgery on my shoulder when I was in medical school that really botched it up. I'm not blaming the surgeon because I loved him. He was my boss. And he was a great professor, great teacher. But my shoulder came out bad, and it was much, much worse after the surgery than before the surgery. And it wasn't until a few years later that I learned about regenerative medicine with an injection to my wrist at a convention of doctors, and I awakened about 24 hours later, and my wrist was about 50% better. I then did my shoulder, and it healed 100% overnight after I injected it with regenerative medicine back in the day. I'd say.
That's amazing. Overnight is amazing. Speaking of shoulders, we have Kevin in L.A. with a right shoulder problem.
Hey, Kevin, Dr. Marc Darrow, how are you today?
Thank you, doctor. I have a question. I just did MRI. MRI says, right, one of the muscles, caused, my arm goes up, is tear, about 2/3,
Yes.
70%. And I was wondering, the stem cell will heal it, or if I do the surgery, and do I need a surgery, by the way? And while I'm doing the surgery, if I do the surgery, the stem cell during the surgery, would it help to add, combined with the surgery?
Great questions. So the answer is number one. Why would you do a surgery if the surgeon's going to put stem cells in at the same time? Okay, that makes no sense to me. Why not just do the conservative route, which is walking into the office, getting an injection of stem cells, and then walking out? Why go through a surgery which is not a conservative procedure? It's a very invasive procedure, and a lot of people like myself who had that came out bad. So that's number one. Number two, these tears can often heal by using either platelets or stem cells. Okay? So I would have to examine your shoulder, and the number to our office, if you want to give it a call to get more information, is 800-300-9300. You can call them right now. And I think there's good hope for your shoulder, hearing what you're saying about it. And I certainly wouldn't do a surgery.
Yeah. Even 70% or 75% tear still will have a chance, with stem cells will regenerate it and will heal it.
Yes, there is a chance, but I can't tell you over the radio what's going on with you, because I need to examine you with my hands and move you around, see if you're a good candidate.
Okay. Sure, doctor. I will get your phone number and I will contact you. Thank you very much for your time. I appreciate it.
Yeah. I mean, we have new patients that come in every day who are ready for a surgery, and they don't get that surgery and they heal up. Not everybody, but most. Okay? So I need to examine the patient and see what I think is going on, and then have a discussion with them about what their goals are. Some people want surgery, and God bless them, they ought to do it. People should get what they want. I don't like it. I cannot remember the last time that I advised a patient to get surgery. It's that long ago.
That's
Steve,
a long time.
Dr. Marc Darrow, you got a shoulder also. Let's hear about it. How long has it bothered you?
Well, it's fairly recent. I have. First, I want to tell you I've been listening to you for a long time. I've referred.
Thank you.
Three people to you, 2 family members and a friend, and they've all been helped. And
wow, that's good news.
I also called you once. I had a problem with my foot, or my ankle, I should say, and I told you the story and how I heard it, and you said, well, Steve, I think that'll get better if you just rested for another few weeks, and it did. So that was.
Well, that's the best healing. Time is the best tincture.
Well, what I'm calling about, my shoulder, I would call it a clicking. It seems like the bone is kind of rubbing in a strange little way, but it only happens when I'm laying down and at a certain angle, doing maybe a crossword puzzle or something. But it's very irritating. But when I sit up, it stops. And I'm wondering if it might be related to any drugs I could be taking. The other thing I'm going to compliment you about, I was put on statin drugs because my cholesterol was higher than it should have been, and I developed this real ridiculous pain in my right arm, and it developed into my right shoulder and my left shoulder, different than what I'm talking about now. But I heard you say something about how statins can cause muscle pain, and so I made an appointment to see my doctor, and then I decided not to stop taking the statins before I went in to see him, and by the time I got in there, the pain had all gone away. So
excellent.
I don't take statins anymore, but I am taking another medication. I don't know if a medication might be the cause of it, or maybe I should try some exercises, or do you think I should come in and have you look at the shoulder?
What is the medicine you're taking?
It's called Zetia, Z-E-T-I-A.
Yeah.
But I'm also taking, what do you call that? Red yeast rice. Yeah, that's some kind of a natural supplement. But my cholesterol has gone down dramatically from those two things.
I hear you. So you're not going to like what I have to say. Red yeast rice is the same mechanism of action as Lipitor or the statin drugs. And it's not monitored because you don't really know the correct dosing. And it does lower cholesterol, but I'm going to bet you don't need to have your cholesterol lowered to begin with. And red yeast rice can cause rhabdomyolysis, muscle pain, just like the statin drugs.
Oh, well, I appreciate you telling me that, because frankly, I cut my red yeast rice thing in half, but it's only a few days ago, so I haven't seen the improvement in my shoulder. But you think that might be causing this clicking in my shoulder?
I don't know the answer to that, to be honest with you, because it sounds like it's not the bones. You know, it doesn't sound like arthritis. It sounds like you may have a scapular impingement. The scapula is the bone in the back, the wings. And a lot of times people will get that little clicking when they're lying down. So that's something I'd have to examine you and figure out what is going on. I don't have the answer over the radio.
Yeah.
I'm not psychic.
Okay, well then maybe what I'll do, I think I'll stop taking the red yeast white rice for a couple of weeks, and if the clicking doesn't go away, then I'll come in and see you. That make sense?
That would make sense, yeah. I mean, as long as your doctor knows what you're doing. I'm not your doctor. I'm your buddy.
Yeah, right. Yeah, right. Well, I like my doctor very much. You know, he's a perfect guy. I just like the fact he's my age. He's talking about retiring. I'm going to have to find another doctor. But, when I told him about how the statin had caused me the muscle pain, he said, "Oh, yeah, that happened to me 25 years ago. I don't take them either."
Well, the truth of the whole matter underlying it is we found out that cholesterol is really not the cause of heart disease anymore.
Oh, I hadn't heard that story before. Okay.
Yeah, look it up. Unless it's super, super high. Most people that are on statin drugs don't need them, and actually it blocks the production of your sex hormones, which you don't want to do.
And actually it blocks.
Did you get that echo, Nita?
Yeah, I don't know what that was.
That was wild.
That could have been Steve. I'll let Steve go, and you can talk to him off the air. Thank you for your call, Steve. So yeah.
Anyway, my point is this: almost all people on statin drugs shouldn't be on them, according to me. I'm not saying what the big is, but according to me, I would never put anybody on it. And what the bottom line on it is, people have the same death rate whether they're on that medicine or not, whether their cholesterol is high or low. Less heart attacks, but the same death rate. So what's the point? No reason to take it. Interesting.
Absolutely. Okay, well, give us a call, 866-870-5752. That's 866-870-5752. You get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Remember, we're here Saturdays at 10 and again at 1 p.m. Do you want to talk about what's going on in the office besides this? Okay.
Yeah, the vampire facelift, that's something you'll never forget. It's a non-surgical facelift where it's very similar to the work that I do on the musculoskeletal system, but it's on the face. And it actually regrows the collagen in the face and makes people look younger, basically overnight. So that's a real simple treatment. We just draw your blood, spin it, and then inject it into the face, numb up the face and inject it. And it could be done with your stem cells also. And what else do we do, Anita? What am I forgetting? Hair. We do a lot of injections into the scalp to regrow hair. And people go, is that real? It's actually been studied quite a bit. And there's a chapter in the back of my book, I'm looking at the book now, all about hair regrowth. And it's something that you may want to take a look at. It's not going to help someone like Dr. Phil, but and we actually do it on men and women. A lot of women actually have hormone imbalance or low thyroid or something like that can cause their hair loss. So about 50-50 on the people that I do it on in terms of gender. So yeah, that's a great treatment also.
Oh, I hear
music. We're going
music.
to the break. Hang with
are.
us, folks. We'll be back in a couple of minutes.
We will. You're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.